Good morning, everybody. Wayne Pyle, City Manager, here with John Evans, our Fire Chief, to talk once again about what's the latest in terms of the COVID pandemic. And particularly today, we want to talk about vaccinations and encouraging everybody to do that. I might mention that you'll see us here. We both have our masks. We're not wearing them for purposes of the interview, but it's also sort of representative of there's a lot of flux out there right now, right, in terms of what's going on with COVID protocols, social distancing, sanitation, or cleanliness and mask wearing. So all we're really going to talk about on that subject today is please just be mindful of everybody around you and wear a mask where it would seem appropriate or where it might make other folks comfortable. And please, for sure, continue to maintain standards of cleanliness, hand washing, social distancing, all that sort of thing, again, where it would be helpful and where it's appropriate. Now, having said all of that, the Chief and I are going to talk about vaccinations again today. And particularly, we want to focus on that because this is the area where we are currently going to have the most effect on driving down this pandemic. Wouldn't you agree, Chief? And could you give us like just a sort of current status update on where we're at with vaccinations?
You know, right now, since the start of the vaccinations, the ability to get them has grown. You've seen that where at first you were going to 2 or 3 facilities. Now people can go to their local pharmacy, they can go to a grocery store that they're familiar with, they can sign up. So there's more availability, and we're just asking people, hey, go sign up, go get your vaccine. It's one way we can try to get back to somewhat of a normal that we were all used to.
Yeah, absolutely. I noticed that this week we passed for the first time 200,000 vaccinations, in the plural, administered in a week. I thought that was a good milestone.
That's a huge milestone, and I think that just goes to show there's more places to get it, more people can sign up, and people are starting to go to those places and reach out to get the vaccines.
Right. We still have a long way to go, though, right? Didn't we?
We do.
We were just talking about the estimate that we think, by our best estimate, we still probably only have about 15% of folks in West Valley who've gotten the vaccination.
Correct. We need to get that up, and we need just asking people that are from West Valley, that we live here together, sign up, get your vaccine. Let's get our percentages up like everybody else. Let's try to reach some goals that we have to get people vaccinated in our city.
Yeah, and let's reemphasize those sources and places again. So, for example, you can go to the Maverick Center and do a drive-through by appointment, and
Correct.
They've got huge capacity.
Huge.
You can go to pharmacies. I've heard like CVS, Walgreens. I don't want to promote any particular brand, but places that have private pharmacies, you can get vaccinations there, right? Where else?
Grocery stores, the pharmacies inside of grocery stores. There's a lot of the pharmacy grocery stores that are starting to do them. You mentioned the Maverick Center. You can go to the Mountain America Center out south. You can go to the Salt Palace.
Salt Lake,
They're starting to pop up, and I think in the future you'll start seeing mobile sites that they will start doing in the near future, which we're pushing for.
Right. In fact, that made me think of an event we had here in West Valley where we had a company volunteer a number of doses of Johnson & Johnson's vaccine, which we were then able to administer across a 2-day period, got that done. And we may have like scenarios of that sort in the future. I guess the reason I bring that up is I would want to encourage, or we would want to encourage our residents to, if you get turned down in one particular place, or it's not convenient, or the appointment's too far out, don't just give up there. There are other places and sources that you could look to get a shot quicker.
There is, and they've made the sign up a little bit easier online. There are some phone numbers you can call if you're not comfortable with that. And quite honestly, if you're by one of your local drugstores that do it, or grocery stores, pop in and say, hey, how do I do this?
Or even ask them, hey, you got any extra shots? I've heard that happening. One of the things we've noticed about the whole vaccination effort is, across time, that the suppliers are getting more doses of vaccine out of each bottle than they thought they were going to, which sometimes means at the end of the day, some of these places have some extra doses left. So it doesn't even hurt to just go ask and say, hey, what's your status today?
That's correct. You're getting more shots out of a vial.
Right.
And so they don't want to waste it, which good for them. Don't waste it.
Right.
They're just opening it up. And now especially where we've reached a point in the state that it's, not just elderly, not just specific responders, but now it's opened up 16 and up.
Yeah.
So it's open. It's open as far as it's going to get for right now, and that's why just try to sign up, try to go get your vaccine. Like you said right at first, the only way we're going to get back to some sort of normal is by doing this.
Right. Anything else you can think of to add?
The only thing I would add is there's still fear out there for the vaccine.
Yeah.
And the only thing I could ask of you or say, if you're fearful of it, call the local health department, or better yet, call your local physician. Just ask them if you've got a fear of, should I get a shot, should I not get a shot. The best source is call your doctor. They know you, and they can give you better direction than anybody. And if they say, yeah, get a vaccine, let's try to get our numbers up. Let's get a vaccine.
Great advice. Okay, thanks, Chief. So I know I've had my vaccination. I know you've had yours. You want to tell us about how the experience went?
Yeah. There was a lot of things out there. There's going to be side effects. There's going to be this. So, I go for my first shot and I'll wait because you hear stuff.
Right.
I had nothing. Arm hurt a little bit. Nothing more than when I got a flu vaccine. I actually likened it to when I had my last tetanus shot, is what it actually was. Going for my second one, and there was still the fear out there, the second one is absolutely nothing. Actually, on the second one, my arm didn't even hurt.
Yeah.
So I had nothing with any of the shots.
Well, and so that's not to say or dispel the notion that you can have side effects, because we all know that can happen.
Right.
But I would say that the vast majority of examples that I've talked to have had experiences like yourself. They either had no side effects or some pretty minor ones, like a sore arm, like you mentioned.
Minor ones, sore arm, I've heard headaches, mild fever.
Yeah.
And quite honestly, when you look at that, if you listen to them, that means the vaccine's working in you.
Right, yeah,
it's getting into your system and it's working.
Yeah, yeah. Okay, great. So there you have it. Folks here in West Valley, please get your vaccinations, get them as soon as you can, and that will let us get through this pandemic sooner and get back to our normal lives again. So thanks very much for listening, and have a great day.